Coronavirus exists. Coronavirus is a disease that
attacks the respiratory system.
the symptoms of COVID-19 are fever, tiredness, dry cough,
Shortness of breath.
headache, sore throat. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs
Or sneezes.
Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by
The World Health Organization.
wash your hands regularly with soap and water or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and stay away from large group of people. Please don't be scared of the virus. Follow the precautionary measures. Stay home, stay safe.
And the Risk Communication, Social Mobilization and Community Engagement Committee. I would like to welcome you to the 45th National Situation Report presentation by Dr. Mustafa Bite, Director of Health Services. Dr. Bite.
Good afternoon once again, ladies and gentlemen. So we are here again to bring the daily updates. This is the 45th National Situation Report since confirmation of the first case of novel coronavirus in the Gambia on the 17th of March 2020, when we recorded the first COVID-19 case. A new laboratory confirmed case has been recorded, making the cumulative total number of cases confirmed in the country to be 18. Another probable case has also been recorded. Both the newly confirmed and the probable test results are results of samples collected from the mass screening held in Bakau. While the confirmed case manifests symptoms similar to those of COVID-19, the probable case is asymptomatic. Whereas the probable case is linked to the 12th case, the epidemiological link of the newly confirmed case to any of the previous confirmed cases is yet to be established. Out of a total of 194 test results received, 192 tests tested negative, 1 was inconclusive, and 1 tested positive for COVID-19. Training on case management, sample collection, risk communication, and infection prevention and control was conducted by the Central Level Rapid Response Team in North Bank East Region. Whereas 5 persons were newly taken into quarantine, that is 2 from CRR and 3 close contacts of the 12th case, 1 individual was discharged after testing negative for COVID-19 upon completion of the mandatory quarantine period. The country currently has 101 persons under quarantine, 8 active cases, and 3 probable cases. A total of and 29 tests were conducted. 18 are positive. 323 people completed quarantine. 735 contacts traced, and 310 people completed follow-ups. Globally, since 31st December 2019 and as of 6th May 2020, a total of 3,818,577 cases of COVID-19 have been reported. Of these, 264,807 deaths were registered, and 1,292,296 recovered from the disease. Senegal recorded 1,433 confirmed cases, 493 recoveries, and 12 deaths. On logistics and safety, security personnel are enforcing the social distancing practice in various areas in Kanifing municipality, ferry crossing points, and markets. The Tourism Security Unit, or TSU officers, embark on routine beach patrol to enforce the social distancing measures. Anti-crime unit, in collaboration with Gambia Immigration Department, conducted an operation in Lower Nyomi on social distancing, where 17 Senegalese were taken into custody for illegally entering the country. 16 of these individuals were handed over to the Amdalai Immigration and 1 to the Amdalai Health Post for further medical assessment and management. 26 people, that is 23 Quranic students, a bus driver, and his 2 apprentices, were intercepted whilst returning from Senegal. All these were taken to a health facility for screening. 3 manifested high temperatures and have been isolated for possible sample collection. On surveillance, 9 laboratory technicians and assistants from Farafenye, Nguyen, Kerewan, Salikenye, and Ilyasa were trained on COVID-19 sample collection. 12 health workers in North Bank West region were oriented on risk communication and contact tracing. 11 samples were collected, 9 from the contacts of the 11 case and 2 from an orderly working at Farafenye, RCH, and the Sun. Part of the response team briefly visited the surveillance officers at Kir Ali point of entry to extol them for the good work they are doing. On case management, Farafenye RCH and nearby health centers on case management and IPC. Psychosocial support services rendered to 36 persons under quarantine. Psychosocial education provided to the family being stigmatized in the URR. On risk communication and community engagement, 4 TV and 8 radio programs successfully conducted. 1 press briefing conducted, 11 communities and 760 households sensitized to ensure there is a synchronized cross-border surveillance system with Senegal, RRTs to investigate and establish the possible source of infection of the new case vigorously and systematically. Follow up with the Supreme Islamic Council on the domestication process of safe Ramadan guidelines on COVID-19 preventive measures. Strengthen surveillance at all points of entry, including the undesignated ones. Voluntary testing of all patients with respiratory symptoms at all health facilities. Engage private pharmacists to report clients presenting flu-like symptoms to the rapid response teams. Finalize SOPs on community engagement and social mobilization for social and behavioral change approaches on COVID-19. Strengthen RRT and contact tracing teams at all regions. and deploy newly hired health personnel to their duty station. Finally, COVID-19 is real, and we would like to urge the general public to strictly adhere to WHO, the Ministry of Health recommendations and guidelines on COVID-19 by desisting from public gatherings and practicing social or physical distancing. Specifically, we would like to reiterate our call to all stakeholders involved in the quality sales or wanted, shopkeepers, salons, barber shops, tailors, and general merchant dealers, that the state of public emergency regulations on their business operations remain valid and will be enforced by the local government authorities and security personnel. We encourage the public to comply with the security forces and COVID-19 personnel whenever they appear to carry out their duties in containing COVID-19. We would like to thank the general public for increasingly using the toll-free line 1025 to report suspects, and they can continue providing valuable information to the call center. Together we can defeat COVID-19 in the Gambia. Thank you very much for your kind attention.
Thank you very much, Doctor, for that elaborate update. The floor is open for subsequent questions. Your name, your media organization, and your questions, please. Yeah, yeah.
Do I have to say my name and media house? Seno Ujai from Gambia. The question is, what happens to patients that have cold, flu-like symptoms and go for checkup? And then when the doctor or nurse says, okay, can we test you for COVID-19 just to be on the safe side? That patient refuses, and then obviously because they don't want to be associated with the stigma linked to COVID-19, then they go for what happens to those scenarios, and how can you advise those patients that refuse to be tested for COVID-19 because of the stigma behind it?
Okay, thank you both, Doctor and Erkan.
So thank you. I think it will depend on the case definition. So the case definition is being expanded. And so, for example, previously it was only if you have flu-like symptoms, or you are symptomatic and then you have a contact, or you are symptomatic or you are coming from a country where this is there, so you have a travel history. So then you'll be called a suspected case. But now it has been expanded, and it is going to include all the ones with flu-like symptoms. So that means you'll be a suspected case. And in this case, we'll use all our tools, the risk communication, psychosocial, to counsel you so that you'll be isolated and tested. But if all these things fail, then they will have to use maybe more rigorous tools to ensure that you are tested. Because now it's not only about you. When you are a suspected case, and we understand that you have to go through that grief once you have this bad news. And our people are trained to handle that, to take care, to make sure that they do all their best not to resort to force. But if it comes to the crunch, then the last resort has to be used. But you have to understand that this will be after all other methods are exhausted, after using religious, using political, using risk communication, using everything possible to ensure that we do it amicably. Thank you.
Thank you, Doctor. Any additional questions? Yeah, go ahead.
This last screening that took place in Bakau, the blood brought from other units. When is the ministry planning to conduct other mass testing in the areas like Karate? And my second question is, when we went to Bakau, we collect the samples and we take them for testing. And I'm sure this new case, it was reported maybe 1 or 2 days after collecting the samples. Do the ministry have any plan of collecting samples and testing them on the same day to make sure that if somebody is positive, that same day that person can go and you know that?
Thank you very much.
Let me do with the prospect.
Thank you very much, Nelson. You asked about whether we have plans to do similar mass screening in communities, especially, you make an example of Farafenni. Basically, our plan at the beginning was to do mass screening in communities that we have registered cases. We've tried to go to 2 communities. It has been, difficult. It has been a challenge. And then we went to Bakau, and we have been warmly welcomed by the community of Bakau. And we did the screening. And now that the rapid response team, they are currently in the North Bank, in Upper River Region, and Central River Region. And when I talk about the rapid response team, it's a combination of all the subcommittee members. You have the logistics, you have the case management, you have the risk communication, you have the psychosocial support, and as well as laboratory and surveillance. These are the teams that are currently up-country, trying to see and talk to the regional authorities, the regional health teams, and as well as the communities that most of these cases came from. And then now that after that discussion, now they will also now start to find out from them whether they will be able to accept for us to do mass screening. These are all these things that we have to discuss with them. We have to negotiate, and we also have to sound our opinion. We don't want to force any community to say you have to come or we have to do mass screening in our community. At that stage, we haven't reached to that stage yet. We don't want to force anyone. We want to do our intervention, and people will look at our intervention, and then based on the benefit they have attached to that intervention, then we want other communities to come and say we are interested in it. We want you to come.